All right, let's get started. Thank you so much for coming.
Oh my gosh.
On your Sunday.
It's been something I've been looking forward to.
Me as well, absolutely.
Yeah.
Well, I think we should just hop right in.
Yeah, let's do it.
I wanted to start with a quick origin story. So
Sure.
Tell me a little bit about why you chose to pursue dermatology. When you were studying medicine, tell me how that all came about. Because I know I always say my villain origin story is like I had terrible, terrible acne. So I know that's sort of a thing across the board with a lot of other estheticians or other practitioners. It's sort of our
derms.
I bet. Yeah. So it's sort of, for me, it was the impetus to first take control of, myself and my health, and then eventually spread it to other people. So tell me about your journey.
Yes. Well, it's interesting because when I was in med school initially, dermatology was not in my radar at all. I was really interested actually in integrative medicine, so more so like alternative medicine, natural medicine, holistic medicine. I know there's so many ways to describe it,
right?
But that was sort of the reason why I went into the healing space to begin with. But when it came time to deciding between like allopathic medical school, like conventional medical school versus like naturopathic medical school, I was like at a crossroads, and I was like, I don't know. But I realized, if I had my medical degree, I could have more options later on in life.
Right.
So in med school, my plan was just to go into primary care and then like specialize in some kind of integrative medicine fellowship. There was like one that was at University of Arizona at the time with Dr. Andrew Weil.
Oh, I love him.
He's amazing.
Wait, so
he's the reason why I went into medicine.
He? Are you kidding? Because
yes.
I used to work at Origins. And he has his whole...
Oh my God, he has his whole line with
mega
them.
mushroom line.
Yeah.
Oh my God, wait, so I like grew up with like rosacea.
Yeah.
And so when I was like 17, I moved to San Francisco, and I was like, I want to do some sort of skincare thing. And it was the first job I like even looked at, and I just walked in. It was the flagship store then. I think they're closed because malls are just shutting down. But anyway, I love Dr. Andrew Weil.
Yeah. So he was my main inspo for going into the field of medicine in general. And then like he was like the track that I wanted to follow. I was like, I want to do what he does. I want to like work with him, train under him. So that was my plan.
Awesome.
And then when I was doing like my third year rotations, I was in internal medicine rotation, and one of the subspecialties of internal medicine is rheumatology, which deals with a lot of autoimmune diseases. And there's a lot of overlap with rheumatology and dermatology because there's a lot of autoimmune skin diseases. So that's what I saw. I saw a lot of like lupus, scleroderma, which is where your immune system's attacking your collagen, dermatomyositis, which is more of a muscular issue, but their skin changes with that. And I just felt so drawn to these patients, and I felt so much empathy for them. And I was like, these are the people I really want to help.
Totally.
And I was like, should I do derm? And then I was like, oh shit, because you have to know early on for derm, it's so competitive.
I hear that. Oh my God, right. You have to know like right away.
Right. Like right when you start med school, so that you can like, I don't know, get research experience in, get to know like derm faculty and stuff. So I was a little bit late to the game. I got into derm by the skin of my teeth. But the other thing that attracted me to derm was I also loved like seeing both adults and kids, and you could do that with dermatology. And then I loved surgery, but I didn't love surgery. Like I didn't want to go into the OR and like manipulate bowel. Like I was good with just like suturing up skin.
Absolutely.
And there's a lot of that in derm, which I appreciated. And then I also was a huge fan of pathology in medical school. And dermatology, when you go through derm residency, so much of your training is dermatopathology, where you're hanging at a microscope. Like 30% of our board exams was at a microscope in Tampa, Florida.
Cool.
Anyways, so sorry, long-winded answer, but because dermatology covers so much ground, and it's just like a fun visual field. I was drawn to it. I'm like, I'm going to do it.
That's amazing.
Yeah.
That's fantastic. I actually, I've seen working with Dr. Sherman. I've been in the space when he's just doing those little surgeries, and I never, I'm sure you had that experience in school, but I had worked within the epidermis up until that point. And so he's cutting down, and we're like, I don't know, I actually, the case I remember is a pilar cyst like on their scalp. And I was like, oh my God, it just keeps on coming. And it's crazy, but it's like such a visceral, satisfying experience. But so seemingly you do more cosmetic in your practice now, right? Or like, so how are you sort of What is your favorite, I guess, when you go into the office, when you're not traveling around and all that, what is your favorite thing to see?
Well, one of the things I really appreciate about derm is the fact that it covers, you get to deal with so many different things, medical and cosmetic. I would say like 60 to 70% of my practice is actually medical derm, and 30 to 40% is cosmetic derm. Okay. So I go in, I'll do like skin cancer screening, I'll treat acne, I'll do Botox, I'll remove a cyst. Yeah, there's like surgery as well. Right. So in terms of, I'm trying to think of like what my favorite thing is and what I look forward to seeing the most. I think it's just the sheer variety itself. Yeah. I agree. Because honestly, if I have like 10 full body skin checks in a row, that does test my sanity. Absolutely. But otherwise, yeah, like I do enjoy doing a full body skin check because the person's like otherwise healthy. Like I'm like chatting with them while I'm like going through their whole body surface area. Right. So yeah, so it's the variety though.
Amazing. I agree. And actually, that's perfect segue into my next question, because you had posted a video saying that you're a derm who's passionate about bridging the gap between Eastern and Western medicine. And one of the points you made in the caption was how crucial the role of the gut microbiome is. Yes. So if you could elaborate on that, or any other tidbits on integrative medicine that you feel like people should really know about, that should be more in the mainstream.
I feel like right now there's a lot of division between like conventional derms and then there's like this whole like hippie natural realm, but there's definitely a lot of overlap. Right. And my goal is to like help people also embrace all sides and understand like the benefits of both sides too. And the gut microbiome is, I think, one of those areas where it really does show like the connection of what's going on internally is manifesting externally, and also like the importance of diet, nutrition, other even like stress, like all those can impact our gut health, which then can impact the rest of our health, including our skin. And we are seeing more and more research coming out with certain bacteria that can have specific skin benefits. So there's some bacteria that can help build collagen. Wow.
The gut or on the skin's microbiome?
In the gut.
Oh, cool.
Yeah. And then the skin microbiome too, also, that's a whole nother field. But yeah, we're seeing that people with eczema, if they benefit from certain bacterial strains as well, that will help decrease inflammation in their skin. Same with psoriasis. There's also some strains that have been shown to help with hair loss. Amazing. So there's like some cool research coming out, and even like with acne too, a lot of people can potentially heal their skin by healing their gut. Now, easier said than done. You can't just like say, you just have to like eat this and have a great gut and your skin will be clear. Like it's hard. And really a healthy microbiome, a healthy gut microbiome is really just one piece of the puzzle when it comes to overall healing. But it is an area that I think more and more people are paying attention to. Right.
And with skin, I think it's probably the cornerstone to just overall health in general. Yes. Right? And it makes no sense. I mean, I feel like I was told by someone who was studying medicine that I don't know how long ago it was, but in the medical textbooks, they would make the assertion that there's no correlation between acne and diet.
I know.
Which makes no sense.
I know. Yeah. It's kind of crazy. It's frustrating as well. But I think that, there's definitely some nice research showing that there's certain foods that can definitely make acne worse. Right. And we're also getting more research showing foods that affect your gut microbiome, which then can affect your skin. Definitely some hardcore derms who really need a lot of evidence before they can change the practice guidelines. Sure. But yeah, I like to be on like the cutting edge part of it. Like if we have some evidence showing it, let's like explore it. Totally. And to me, it's like, it's not going to hurt someone to minimize processed sugar. Right. And increase their consumption of fruits and vegetables. Absolutely.
No, actually, it's funny you said. So I think there are a lot of patients that are attuned to their own physiology, and they can sense when they've ingested something, like maybe it's a few days later, but it's caused a breakout in them of some sort. And there are other people that think that they can eat whatever they want and there's no correlation whatsoever. But I actually had a patient and a colleague who, she said for about a decade, would break out in all of these inflamed pustules on her face and neck. And she was treated for a long time for acne, rosacea, herpes simplex. And then finally she went to an endocrinologist and they found out that she has celiac disease, and she stopped eating gluten and her face just cleared up.
Wow.
So like, yeah, I mean, I don't know, that's one instance, right?
Yeah.
Not an entire data set, but I mean, it has to make a difference, right?
Yeah. Food, like, it definitely, it's, to me, food is medicine. Like, it makes a difference.
And you're, like, I don't want to get into the whole blue zone thing right now, but you're Japanese, right? And you probably grew up eating half Japanese. Probably grew up eating like more fermented food or other like really antioxidant rich food that the standard Western diet doesn't have. And I think we see correlation in a lot of those populations. They're living longer.
Yeah, exactly.
Their skin's looking great.
Yeah.
So yeah.
And like also if you go to like countries, kind of third world countries or countries that aren't as developed, like there was a study that was done in like people from Papua New Guinea, and like nobody has acne there.
Right.
So it makes you wonder like what's going on in our environment with like the whole industrialization of food. Then there's like this whole world of like plastics and potential endocrine disruptors, because like so the gut health is important. Sorry, before I talk about endocrine disruptors, fiber is something that we're also lacking a ton of. And we're seeing that, like, that's one of the biggest things I recommend to patients with acne actually is to increase fiber in their diet, at least 30 grams. Just because fiber is also feeding good bacteria. It's also pushing out waste. We just don't want waste lingering. So that's just a tidbit. But yeah, that's something that's like kind of more part of that standard Western diet, is that our fiber is lacking.
Right.
But yeah, there's so many other pieces in addition to the gut microbiome. It's like, okay, hormones, what's going on with the hormones, and what could be affecting the hormones? Is it stress? Could there be like weird microplastics or other chemicals? We don't have as much data, but stuff is more stuff's coming out. 30 years. Yeah, exactly. Yeah.
I know.
And then and then I don't know, like there's mold, EMFs. I don't know. There's like so many other interesting
it's
factors.
A puzzle, right?
It is a puzzle.
It's crazy. Well, actually, this was going to be a question I ask later, but I think we can jump right into it because, so I know you see the patients that come in looking like they baked themselves in the sun every day, back in the good old days. And like, they tell me they used to do the baby oil and iodine thing with the foil.
Oh my gosh, yep.
I'm like, well, and so now they're coming in for skin checks every 3 months. They have their Mohs surgeon on speed dial, all of that, right?
Yeah.
So my question is, what do you think we're doing nowadays that in like 30, 40 years, we'll look back and say, what were we thinking? I know that's a hard question because we don't really know, but I wonder if anything comes to mind right away.
Yeah.
Like, back then they weren't putting the sunscreen on, and that seems to be such an obvious thing to do now. Do you think there's anything that's going on right now that we can see?
I wonder with our phones.
Oh, sure.
Like, I think that we need to see more data with EMFs. I think that there is some scary data, but we just need to see more.
Interesting.
But I think the whole like blue light circadian rhythm disruption aspect of it, I think we're going to see that it is going to have consequences. Circadian rhythm is just so important for overall health. Like certain genes are turned on when the sun rises and when the sun sets, and when that's disrupted, we see higher rates of inflammatory disorders. So people who are like night shift workers and stuff, we're seeing higher rates of cancer and chronic diseases like cardiovascular disease, like heart disease, stroke. I was like learning about all this because like I was noticing in my own patients that like I was seeing a lot of psoriasis in people who worked at night, like nurses who work at night. I had a patient who was a stripper, and she had terrible psoriasis.
Yeah, poor thing. Can't have psoriasis in that line of work.
Exactly. Right. Yeah, she couldn't afford to do that. And then like students who would pull these all-nighters as it got close to exam time, I would see that their psoriasis flared. And then I saw that there was a study that was done that looked at women who had psoriasis, women who worked at night, had higher rates of psoriasis. Wow. And so just coming back to the phone thing, it makes me wonder, because when we're exposed to that blue light, it does also affect our circadian rhythm. And I just wonder if it could affect like other diseases.
Right. That's fair. Yeah. That's interesting.
But I'm trying to think if there's any other like things now, skin wise too, even.
Because back then it's like, I mean, you know, like cigarettes are good for you.
Right, exactly. Yeah. I think alcohol is going to become more and more of a thing that we're realizing is not good on any level.
Oh yeah.
Surely. And it's cool. We're already seeing a movement. Like people aren't drinking as much. I think there's like more gatherings and events that are like alcohol free.
Totally. Or they have the alternatives now.
They have like more alternatives. Yeah. But alcohol definitely plays a role in like a lot of skin diseases, psoriasis, rosacea. I think that it can make acne worse.
I'm sure.
So I think we're gonna like see more of a movement that wrinkles. It's crazy how much it can accelerate aging in people. So
I'm sure.
Yeah, I mean it's too bad because like it's also fun too, and like I do think that having an element of fun and like enjoying life is important for like overall health too. So like it's balance.
Yeah. Yin-yang. Absolutely. Amazing. So I was trying to think of. One of my biggest passions, personally, is the enigma that is rosacea. Yes. As you know, it can present itself in different ways, and I see it pretty much every day in clinic. And I have it myself, and it's mostly under control on my face. But I actually suffer from pretty severe ocular rosacea. Oh. Yeah, like, and I was reading into it a little bit, and the correlation between blepharitis and ocular rosacea, and it said it mostly affects women over 60, and I'm like, well, that's cool. I don't know, But no, I would like I think I would get these chalazia 4 or 5 times a year. Like hardcore, super into and it's unsightly and it hurts and everything. Yeah. But anyway, I guess my question is, what is your frontline approach to treating rosacea in patients? And what would your advice be to someone who can't afford to come in to see a dermatologist and get prescriptions? So I guess my first question is, what are if you're allowed to talk about that? Like, okay, cool. What are your favorite prescriptions to prescribe patients with rosacea? And then if you had an alternative for people who would have to sort of suffice in a drugstore to try to treat that.
Yeah, well, I would say for anyone with rosacea, you know, you're just blessed with your skin's just desire to react more readily to various stimuli more than the average person.
Sure. I love hearing that spin on it. It's great.
Right. And there are a lot of potential reasons for that. Yeah, the main thing with patients with rosacea is to use products that are gentle, that won't potentially compromise the skin barrier, because the goal really is to build that skin barrier. If you have a more resilient skin barrier, you are less likely to react to the variety of stimuli out there. So gentle cleansers, moisturization obviously is really important. Sunscreen is really important. I will typically recommend more of a mineral-based sunscreen, just because even chemical sunscreens can be a little bit irritating for some people. Not everyone, of course, but for some people. So that's kind of like the basis of a skincare regimen. And yeah, so I'll start with that. And then in terms of like, I also like to like look for triggers too. I'll ask patients, you know, when do you notice it more? Right. And I'll ask them too, like, do you notice it if you like go out to eat or have some alcohol, or like when you're stressed or when you're exercising? So looking for triggers that potentially can dilate blood vessels.
Right.
And then sometimes it could be random triggers. Like for some people, it could be certain foods, like it could be certain foods like tomatoes
I've heard that.
Orange, like citrus foods, chocolate.
Enzyme foods, acidic foods.
Acidic foods. Coffee is a big culprit too, and it's hard to say if it's the heat or something else in the coffee.
I'm gonna forget you said that one.
I know, it's so sad.
I know.
And then it's interestingly, I will also ask patients if they have like any GI symptoms too, because there have been some studies showing this correlation with a couple of different internal gut issues, one of them being SIBO, small intestinal bacterial overgrowth, correlating with rosacea, and another one being acid reflux caused by, which is mainly caused by this bacteria H. pylori.
I was reading into that. I got tested for it.
Did you?
Because I was curious.
Yeah.
Because I was like, why do I keep on getting these styes? I didn't have it. So I got to taste that really delicious drink and blow into the bag. Anyway.
Oh my gosh.
I know. I was like, I literally have no, I was looking to sort of see, give me a reason, give me an answer. Because, you know, what you were saying about all the triggers, I mean, I guess, you know, all of the above, maybe. But then also I was like, I needed there to be one like smoking gun, you know, And I was like, so I can fix it, but it wasn't that.
I know. And I feel like there's still so much we don't know. And ocular rosacea is interesting because I think it could also be related to like, so skin microbiome also is really huge when it comes to rosacea in general. And I also think it's like the microbiome of our eyelids, our eyelashes. It's crazy how many organisms like live on our face. We know like Demodex mites are a huge trigger for rosacea on the skin. And there's like other organisms that can also trigger like in the blepharitis and ocular rosacea. But yeah, and sometimes it could be a mystery too.
Yeah. As we've seen. I know. Well, it's great. So what I'm hearing is keeping it all gentle, making sure we're not doing anything to cause reactivity. What kind of prescriptions is your favorite frontline approach to treating?
It depends on what kind of acne the person's, what kind of rosacea the person is dealing with. If they have more of an acne rosacea appearance, my favorite is I usually use a compounding pharmacy to mix 3 different topical prescriptions: ivermectin, metronidazole, and azelaic acid. And they may have a little bit of niacinamide in there too.
Cool.
Just to get at like the papular pustular aspect of the rosacea. There is some anti-redness components to those ingredients. So that's my favorite. And then also, depending on the person, I may also add a sulfur-based face wash, like a sulfacetamide sulfur wash. And then if a person's strictly just dealing with redness, I'm a big fan of oxymetazoline, which is like the brand is Rofade.
Or like Afrin, right?
Or Afrin spray, which is not as like formulated for the face. Skin, there is this like hack that people can do where they can mix it with like CeraVe PM or something and like mix it really well and try that. But that's not something that we typically advise people to do. But yeah, and then like for really persistent redness, if you're just like, I can't deal, then like laser treatment. And then there's also oral doxycycline, which sometimes I'm just like, this feels ironic to give because like we probably need to do more on their gut health too. There is a low dose doxycycline that has more anti-inflammatory effects as opposed to the antibacterial effects. I still think it affects the gut microbiome, but that is helpful for people who need a little bit more help in that regard. So yeah, those are more the prescriptive treatments.
Yeah, you know, it's funny. I've done all of it.
I'm sure you have. Yes.
The Oracea essentially is the brand name, right?
Yes, the 40 milligrams.
Doxy. You know, it seems to help immediately when you're taking it, but then you get off of it, and then I at least personally saw, you know, inflammation recurrence. So it's kind of great as like a Band-Aid maybe. Yeah. Would you say that?
Yeah, it's a Band-Aid.
Or just to sort of
this is all
to control a flare up, or just to sort of get things under control and then give you the opportunity to assess diet, you know, all the regimen stuff. That's great.
Yeah. And I would say that like, yes, a lot of these conventional treatments are Band-Aids. One other thing that I do recommend to patients, and then I could go over like over the counter things that I like, ingredients. But there's a probiotic. I like it for acne more so, but I think it could also benefit patients with rosacea. It's called Serene Skin, but it does have some like acne bacterial strains that I think can also be helpful for rosacea.
Great.
So that's one. Another thing for people who want to avoid like other like oral prescription medicines.
Right.
But there are some like really great over-the-counter like soothing skin options. I'm a big fan of like La Roche-Posay because their line, the Toleriane line, has like a lot of like soothing properties to it. All their products have the La Roche-Posay thermal water, which has like selenium, other minerals, and like prebiotics, which help like rebalance your microbiome and soothe the skin. Aven, another French brand, has products from their own thermal water from Aven. So I love both of those lines for people with rosacea. And then like products that contain like Centella asiatica, which is a soothing sort of like anti-redness ingredient. Also products with ingredients like licorice and feverfew, like Aveeno has like feverfew in their products. Eucerin has, or maybe Eucerin does too, but also has licorice. I mean, there's so many other brands out there. And then like La Roche-Posay has like something called Rosaliac AR, which has like some like soothing like neuropeptides in it for people with redness. And
interesting. So that has an effect on vasodilation. The neuropeptides.
It does, yeah.
Oh, cool. That's interesting.
There's a brand I feel like that's also appreciated in the esthetician world, Giamarini. They have she has a rosacea product. I don't know what it's called off the top of my head, but patients who've used it have really liked it.
Great.
And then you can also get sulfur over the counter too. Like the sulfur soaps and whatnot. So that's something that's over the counter that people can do with rosacea. And then like trying to avoid stimuli. I definitely do think that there is a genetic component too. So I would give yourself some grace as well. Like certain ancestry is more prone to like that reactive, like the vessels are just programmed to like spaz out more easily.
So interesting, yeah. Like, do you, cold climate? The people like sort of people of Scandinavian,
Scandinavian,
Gaelic,
Irish, Gaelic,
ancestry. Maybe because they were like always cold. So like, I have no idea.
I know.
Isn't that weird? Yeah. The rosy, ruddy complexion. No, like skin is weird. Genes are weird. That's what I've come to find out.
Skin's weird. Genes are weird. It's very complex. The ocular, I think, in the chalazion dyes, I feel like that's a microbiome thing.
Interesting.
But that's also complex.
Right.
Yeah.
No, that's so cool. I'll have to pick your brain more about that.
I like hypochlorous acid spray.
Oh yeah. Live on that.
Yeah.
Totally.
Okay. There's like some that are like made for the eyes too.
Oh yeah.
Okay. I don't know if you've tried that, but like there's a brand that I can't remember what they were. They sent me something and they were like, this is made for people who get styes and like ocular rosacea and like blepharitis. So that's something to think about.
Cool. Yeah. No, hypochlorous acid lives in my gym bag for sure. Yeah.
Love it.
Love it. And sulfur wash, amazing. How about colloidal oatmeal?
Yes, I forgot about that one. I'm a fan. Like literally it soothes the skin. I think that we think of it a lot for eczema, but it can definitely be great for people with rosacea too. Like Aveeno has one that's made for the face, is formulated for the face.
I've got one more question.
Okay. Oh my God. I feel like I could talk to you forever.
I know. I feel the same way. I'm like, we can just roll forever. We can totally chat. What's my last question for you? Just because, actually I have two. Okay, so even though I may not look like it, I'm actually multiracial as well.
I was gonna ask you.
Yeah. So my dad, it's a whole thing. My dad is Brazilian, but by way of Italian and Norwegian.
Cool.
So probably the rosacea thing. And then my mom is like Jewish American and Pacific Islander from Guam.
Whoa.
So yeah, it's super complex. I came out looking this way. My brother, he's 2 years younger and he's melanated. He's like brown hair. If he goes in the sun, he'll get dark, brown eyes, all of that. It was really interesting.
Yeah.
But so my rosacea is pretty evident. I think he has rosacea as well, but it led me to want to ask you the question of, I'm sure there are so many conditions that are underdiagnosed in people with skin of color.
Yes.
Like rosacea. Can you speak to that? Like, what do you see in clinic? And then is there an approach you take differently, or is it sort of the same?
It's pretty similar. There's a slightly different approach. So when people with skin of color, especially when the skin is even darker, redness doesn't look red.
Right.
It looks even more violaceous too. Sometimes it could look red. It depends on like the depth of the skin tone. But it can look like, more violaceous, and sometimes it could be super subtle.
Right.
In people with skin of color, I'm actually even more cautious about like I'm even kind of more adamant about really using sensitive products too. Just because I think a lot of people also are concerned about the hyperpigmentation as well, and sometimes that can even mask some of the redness and some of the rosacea.
Right.
So it's like, okay, we just want to avoid anything that can make the redness worse. And I'm probably even bigger proponent of sunscreen as well. It makes such a huge impact with not only the rosacea, but also the hyperpigmentation.
Do you see those in conjunction a lot? And then you have to, and you're sort of stuck trying to see, what do I treat first?
Yeah.
Right. Because it's like one, I'm assuming if you're trying to treat hyperpigmentation, you're wanting to use a bit more active products.
Right.
And then that could in effect, like aggravate the rosacea, redness, whatever sensitive skin that they have.
Exactly.
That's interesting.
So I'm like a really big fan of azelaic acid because it's both anti-redness and anti-hyperpigmentation too. And it's like still gentle enough for the skin.
Right.
I like azelaic acid. I kind of like think of it like niacinamide. They're like a jack of all trades, but a master of none.
I see.
Like they have all these wonderful benefits, but it's not like amazing at like all of them. But I still think it's a nice purpose ingredient. I prescribe it a ton to patients with skin of color.
Great. That's awesome. Yeah. To use in conjunction with something else.
Yes.
Word.
And lots of sunscreen.
Yeah. My stepmom is Asian, and she's got melasma, and I know that's a big thing in the Asian community.
A
lot, right? I guess, are there other what other sort of racial diaspora? Hispanic.
Yeah, we see it a lot in Hispanic.
Yeah.
But of course, Caucasian people.
Right. And that's tricky, right? Because so I do certain like laser treatments and IPL, and you want to stay away from melasma. Is somehow it's hyperpigmentation, but it reacts and responds and acts differently from every other one.
Yes.
So I guess what is your, and I didn't plan to ask you this, but what is your favorite thing to treat melasma? Because it's a really stubborn beast.
So stubborn, and it's so also really dictated by internal factors, and can also be a mystery black box, but hormones we know play a huge role, because we see it gets worse with pregnancy, it gets worse when people go on or off birth control. Right. And we see it in the setting of Hashimoto's too, like thyroid disease, and we can throw everything in the kitchen sink at it, and it could still come back. But my favorite way to treat it, I think the most important cornerstone, is topical skincare.
Cool.
And I am aggressive. I do use a lot of hydroquinone for melasma, but it's just a bummer because you can't use it long term. I will cycle on and off hydroquinone. So I'll do like a compound that includes like tretinoin and hydroquinone, and then like a very mild steroid to offset some of the irritation that people can get from tretinoin and hydroquinone. Steroids also can lighten skin too.
Right.
That's obviously not a long-term solution either, but I'll do a compound with that, and then if it's really severe melasma, then I will also do oral tranexamic acid, which works amazing in the right person.
Right.
And then like in terms of if I want to get people take a break from hydroquinone, some like non-hydroquinone skin lightening products I like are cysteamine, which the classic product is Cispera.
Okay.
That's nice. And then I have to like list more like products and brands. Right. Like Skin Medica has their Even and Correct that is really nice. Like their whole set. There's like a serum and like these peel pads.
Great.
That I like. And then I'm also a fan of the it's by La Roche-Posay, their Numella B3.
Right.
And then Anti-Age is a smaller brand.
Brightener. I love them.
Yeah, the brightener.
There's a tranexamic acid is their main ingredient, right? Along with the exosomes.
And the exosomes. There's a couple of other skin lightening ingredients in there. Yeah. So that was a good one too.
Yeah, I love that
one. And then there's another brand. It's actually developed by an Indian female team, and it's called the brand is called Lion Pose. Cool. But it's like targeted for people with skin of color, which I like because it has some gentle exfoliating ingredients too, because exfoliation is also a really important part of melasma skincare.
Right.
This has gentle exfoliants as well as like, I believe there's tranexamic acid in it too. But there's like azelaic acid, tranexamic acid, lactic acid, like a little bit glycolic acid. But that's another one I like for people who want like a gentle exfoliant. Now, in terms of procedures, I really mainly just do chemical peels. So also we're learning too that heat plays a role with melasma, and vessel dilation can make melasma worse too. And sometimes I'll see a lot of overlap too with like rosacea and melasma. So I typically stay away from lasers. Now lasers can be effective, but it's like one of those things where you just have to be so freaking adamant and strict about avoiding the sun. I bet. Yeah, and it can come back still. Yeah, no, and you have to cross your fingers, be like, well, I guess you have to just see like if it's gonna help, it's gonna help. If not, but yeah, I like chemical peels. Great, awesome. Well, thank you for that. All right, so a lot of my audience are people my age. We're about to hit the big 3-0. Oh yeah. What should we be doing to ensure that we age as gracefully as possible? Is there such a thing as too much when we're talking about people in their late 20s into 30s? Should we be waiting to do things like Botox, filler, laser, et cetera, et cetera? What is your opinion? Yes, when it comes to procedures, it's really person dependent. Right. I would say, I mean, an 18-year-old may qualify for Botox, while like a 35-year-old may not need it. True. So it depends on like how severe your wrinkles are and like really what your goals are too. But I would say on average, when it comes to procedures, Botox, I usually see people starting around their late 20s, early 30s. Right. And yes, because we start to see lines come out, I would say around the eyes, forehead. Fillers, it's also one of those things that's person dependent. Some people genetically may have more accelerated volume loss. Something where if I do fillers in people in their 20s or 30s, it's honestly typically for under eye. And that's, I would say, more of a genetic thing. Sure. There could potentially be other factors that can accentuate the hollowness under the eyes. Right. But I would say it's more that in people who just want like bigger lips. Yeah. I would say that's more like 20s and 30s. Yes, I do start seeing people in their 30s who want more like anti-aging kind of aspect of fillers. But I would say you probably don't need fillers at this stage. Right. It can age you, right? And it can age you if you do too much. Of course, exactly. It's about the practitioner skill, of course, right? For sure. But we see, I mean, I know when I'm scrolling, I see, I follow all these like channels, and they'll show a picture of a celebrity, and I won't say names, but like, they 2 years later look widely different, and they look 10 years older because of like all of the filler they've gotten. It's just like, and then they put the hardcore makeup on too, and it's like, yeah, you look 40, girl, but you look 20, Yeah. So it's interesting. So yeah, I would say fillers are probably not necessary at this stage. In terms of other procedures, I think that like a chemical peel could be like a nice gateway procedure into that world of chemical peels and lasers. If I do lasers on somebody at around late 20s, early 30s, it's usually if they have like redness that they want to deal with. Gotcha. We don't carry this laser, but I would say if people want, just like if you want to do a laser that is like a little, just a nice, like just to kind of help like even out your skin tone, set a nice little canvas for your skin. There's one that's called the Laser 360. It's sort of IPL-ish. And then there's one called the Clear and Brilliant. I think those are like good beginner lasers if you're in your like early 30s. If you want refreshing. Yeah, nothing that's, ablating the skin or just like causing, like you're not trying to jumpstart all of the collagen because you still have some in reserve, right? Yeah. Some in reserve, yes. Yeah. And then of course, skincare to preserve the collagen as much as possible, sunscreen being the most important aspect or most important ingredient or product. And then a retinoid for sure.
Perfect.
And then like good antioxidants during the day.
Awesome.
If you want to include like peptides to
Yeah.
help, like in your moisturizer, that's like an easy thing to
Right.
do. But yeah.
Great. I feel like I can pat myself on the back now.
Oh yeah, I'm sure you're acing it.
Well, no, I think I think that's a great. I love to hear that feedback, just because I think there is a lot of pressure on social media nowadays,
Yeah.
especially where it's, you're seeing people with dispensable income that can just get all the things done, and they're younger than you, or older than you, and looking like they're spending all this investment, and you sort of feel pressured to live up to a certain standard. But I think what you said resonates with me. Like prevention, balance, and just sort of like doing all the things you can do without feeling you're putting too much pressure on it.
Yeah, definitely. I know it's funny, like I work in a derm office, but I feel like I get Dysport and Botox.
Sure.
But I feel like I don't really do other things, and I'm like, I need to. I like microneedling.
Me too.
I'll do microneedling like once a year.
Nice.
Myself.
Great.
But that's a good gateway procedure if you just want to like help like refresh your skin texture. Want a little glow. I like that.
Definitely. Perfect.
Yeah.
Well, thank you. This has been super fun.
I love
this. Yeah, this is great.
Yes.
We can go forever. But
yes.
Well, thank you, Dr. Mamina. It's been such a pleasure.
It's such a pleasure.